Vaccine scaling up production and equitable distribution remains the major barrier to ending the acute stage of this pandemic. It is a travesty that in some countries health workers and those at risk groups remain completely unvaccinated. Vaccines you got from India and China. The effort to achieve vaccine equity will not stop this week. WHO will continue to call on governments to share vaccine doses and fill the $22.1 billion gap in the Act-accelerator for the equitable distribution of vaccines, rapid tests and therapeutics. We will also look to find new ways to work with manufacturers to boost overall vaccine production. Later, I think there was some breakup again.
So we expect that probably by the end of today or the day after, so Wednesday or Thursday, we might have a fresh conclusive assessment from our experts. But as I've said already, at the present moment and under the assessment that we have from the data submitted up to yesterday, we are confident that the benefits risk assessment for the vaccine is largely still positive.
On est parti. Et voilà, vous pouvez appuyer et vous pouvez attendre du coup en salle d'attente.
We continue to see a number of events that are rare events linking thrombocytopenia to thrombolytic events, and those rare events are now being categorized in terms of the diagnostics, in terms of the population, in terms of the distribution within the population, and the expert committees will come to decisions in coming hours and coming days about what will be the regulatory status for the vaccine. For the time being, there's no evidence that the benefit risk assessment for the vaccine needs to be changed. And we know from the data coming from countries like the UK and others that the benefits are really important in terms of reduction of the mortality of populations that are being vaccinated. So.
Non, à l'époque, c'était du Covid, le fois on est monté à 4, on arrêtait pareil dans sa voiture ou dans la tête.
Comment ils disent que ce variant-là, il n'est pas dépistable à la PCR classique.
I want to make that very clear.
Yes.
As a man who suffered.
As you know, as we were here in the meeting already in this press briefing, there was a denial from the European Medicines Agency concerning the existence of the link. What happens is that there are a number of committees right now and regulatory agencies and regulatory authorities looking at data, and new data is coming every day and assessing those data. So there's no link for the moment between the vaccine and the thrombolytic events with thrombocytopenia. Of course, it's under evaluation and we wait for some feedback from those committees in the coming days and in coming hours.
On the floor to questions from the media. We have a long list already, but in case you want to get into the queue.